Hello, welcome back to Medica 2025 at Düsseldorf. I'm at the booth of Cottras. We have Mr. Dongjun Lee, a sales manager of Cottras, right here. We are going to do some interview with about their products they are exhibiting it here and what's their goal at the exhibition. And after that, nice to meet you. 안녕하십니까? Could you introduce about your company first? 일단 회사 소개를 먼저 부탁드립니다.
We are Kotrus, and we are Korean-based manufacturing company. We have been in the field for cognitive rehabilitation for over 25 years. But for the last 5 years, we are also developing and manufacturing physical rehabilitation devices as well. For this year's Medica, we brought 3 different products, Reha board and FES board and Kotrus controller. And today I'm going to explain these 3 different products first, and then also our physical rehabilitation lineup.
I see. So could you introduce one product by each? Can you introduce that Reha board first?
Reha board is upper extremity rehabilitation device. As you can see, it's moving automatically. It's a robotic device. It's for both acute phase patients and subacute phase patients, because for acute phase patients, many of them, their arms are paralyzed and they don't have movement at all. But because we have a passive mode, the robot automatically helps the rehabilitation. So the burden for the therapist is much less than some of other competitors' products. So after some rehabilitation period, the patient can move to assist mode and then finally to active mode. So for assist mode, we can set the ratio of the robot's power and also patient's power. So you can set it to like 50-50, then robot will guide the movement of the patient. And finally in the active mode, then 100% of the patient's force will be used for rehabilitation. And also we have various assessment modes, for example, endurance mode, maximum mode, and also ROM mode for various testing. And also for reports, we can compare intuitively, very easily, before and after the rehabilitation process.
I see.
And also, because in Korea, upper extremity devices fall in the category of occupational therapy. So we have various cognitive elements in the contents. And the contents, they reflect everyday lives. For example, like washing dishes and doing the trash and the recycling the trash and so on. And making noodles, for example. Our customers like it.
Yeah, I see. Like this. So this is cotton candy maker, and I think like not just even a rehabilitation purpose. Like I think this will be also useful for immersive gaming experience, or like maybe you can use it as like a drawing tool.
Exactly. Until now, the upper extremity rehabilitation in many cases has been like kind of boring. You know, like the patients are asked to move like square wooden blocks and so they get bored easily. But as you can see, it's interactive. You can see the screen and it's moved by your movements. So it's much more interactive and engaging.
So making the recovery process much more entertaining and funny.
Yeah,
I see.
That's our purpose.
I see. Can we move on the next product you're exhibiting here?
Yeah, so this is a FES board. Basically, it's a FES device, but as you can see, there are 8 different outputs. So the therapist can use for many different muscles at the same time, or even for multiple number of patients at the same time. And also, there's a knob that can easily control the magnitude of the electricity. And also, it has 6 different modes. And also, our products can be also used for BCI, the brain signal purpose. And we build this product so that our potential customers, they maybe want to build their own equipment using FES functions, then we can provide OEM services. And if they provide us their protocols, then we can change the firmware according to their needs.
Yeah, that sounds really impressive. Can we move on to the other next product here?
So this product is Contras, and we've been in the cognitive field for the last 25 years, and it's one of the most loved product in the cognitive rehabilitation field in Korea. We built this product with the help of some of the doctors and professors in the cognitive field. So it's very intuitive and easy to use, but each content, as you can see, it reflects various domain of cognitive functions, and also it has assessment modes and also reporting. So the therapist can easily print out the end result and compare before and after. And it also has many gaming elements in it, so the patients will not get bored easily. So the cognitive rehabilitation became much more interactive and fun.
Yeah. So I see the big one and the small one. Is there any difference between these?
Yes. Thank you for asking me that. Until now, we've been selling this product. So as you can see, this is an HP touch computer. So we provide this product software installed in the HP computer before, but for exporting purpose, we developed a new controller. So this one is different because, as you can see, this is just normal touch monitor. So our distributor can buy their own from their country, any touch monitor available, and then they just connect through HDMI cable to this controller. Then the computer and the software is built in the controller. So whenever there's an after service issue, they can handle it easily locally. But before it was not so easy.
That's really that sounds really comfortable, and this, no matter what kind of country you are at, this can be applied any part of the country.
Yes, exactly.
Can I see some demo of this product, please?
Oh yes, as you can see, this is the menu. Actually, there are various different softwares, but today we are demonstrating the kids version. There's a training mode, so you can see various training contents, and also you can see the results. So for each content and how good they've done is shown here intuitively, and you can see the change of graph comparing each different dates, and you can also print out the results really easily. And let me check something like popping balloons. You can set the time limit and like speed of the balloons. For each element, there are various factors, elements that the therapist can choose from. So depending on the patient's condition on that day, they can slightly change the values to make it a little bit more difficult or easier. For this one, you use the controller. This is a very easy one, but for like patients who have strokes or like traumatic brain injury, they have difficulty in like distinguishing colors and the directions and numbers. So as you can see in our controller, it reflects all these elements. But this content is a very intuitive and easy content, but for patients' view, it's a kind of a game-like content, right? There has to pop the balloons.
That sounds really fun. I mean, it looks really fun. I really like how it designed, like that resembles like a gaming controller. So this is your first day at Medica 2025. What kind of buyers do you specifically looking for?
Yes, actually we've been doing pretty well in Korean market for selling cognitive devices and also physical rehabilitation devices. And also there are some foreign partners, they are willing to import our products. So that's why we decided to exhibit in Medica. We are hoping to meet distributors from all over the world and who have some experience in distributing products in the rehabilitation field. So now we have been communicating from distributors from Thailand and Vietnam and also from some of the Eastern Europe countries. But during this Medica, we would like to meet some customers from maybe America and also from other countries in Europe.
I see. So I really hope you have a great success at this Medica 2025. Is this your first time being exhibiting at Medica, or did you previously?
This is actually the second time.
Second time.
Yeah.
I see. So this will be your second time. I hope you'll be more experienced about this environment more than others, more than first timers. I see.
Maybe, I'm not
Yeah.
sure.
Do you have any plan you want to share after this Medica 2025?
Oh yes, actually we are collecting all the data we need from the distributors who are visiting our booth. Actually, today I've already met 3 different CEOs from who have been distributing rehabilitation products, and I made reservation to send them quotation, and also they promised to send us the required document list. Then we'll check through that, and if we can provide the data, then I think we'll be able to sell it.
Yeah, that's a really great start for the first day, and it's been the hall just opened like 2 hours ago, and you already got 3 buyers interested. That's really amazing. I mean, I like the speed of this company has been achieving at this place, and
Thank you.
I really hope your great success at the Medica and from now after on. Thank you for your interview today, and I hope you have a great day. Thank you.
Thank you. You too. Thank you very much.